Well, if you've been trying to lose weight by exercising and eating right, but you're not seeing results, your problem might be stress.
Dr. Tunis Hunt from Hunt for Wellness joins us this morning with more on this subject. Dr. Hunt, it's great to see you. Thanks for being here.
Great to see you. Thanks for having me.
Okay, so many people say they're doing the right thing, doctor. They're eating well and that they are exercising all the time and they still can't lose any weight. What is that about?
Yeah, one of the most common struggles we hear from people is their inability to lose weight or get through even a weight loss plateau despite dieting and exercising. And what people fail to realize is how important hormones play in their body's ability to actually burn weight. So when your hormones are dysregulated or even imbalanced, you're going to struggle with weight loss despite the dieting and exercising.
Well, what's the #1 hormone that's the culprit of that? What is that?
Well, you know, believe it or not, it's a hormone that most people overlook. It's called cortisol. Cortisol is released by your adrenal glands in response to stress. And a lot of people understand the big three, estrogen, progesterone, and even testosterone.
Yes.
And they'll have those checked and even worked with. But if cortisol is left unchecked, they'll struggle with weight loss. And that's because cortisol's primary job is to break down fat for energy. And when your cortisol levels are out of whack or out of balance due to high stress, and we all have that, you're going to struggle with weight.
So how do you determine if cortisol is the issue for a patient?
Well, first and foremost, most people understand stress is huge in their lives, and so it's not a lot of convincing to have somebody get tested. The good news is the testing is relatively inexpensive and can be done in the safety of your own home, and it's a salivary test, and that's because cortisol fluctuates throughout the day. So a simple blood lab can show cortisol levels, but sometimes an inadequate level is usually diagnosed, and a lot of people don't get the answers they're looking for.
Well, what is the treatment for those people who find themselves with this issue then, Doc?
Well, the good news is most of the treatment can be lifestyle or even dietary related. So the Empower is back to you. Our biospecific health and weight loss program specifically walks people through all those dietary changes and lifestyle changes they need. In some instances, nutraceuticals, vitamins, minerals, and even hormone therapy is necessary, but a lot of it can be done just the diet and lifestyle.
You can do a lot with your diet and lifestyle.
You really can. You really can.
You wrote an ebook about the subject?
I did. I wrote a book called The Adrenal Code, and I wrote it primarily for my patients. It was a good way of giving them the resources they need to go home and do what they need to do to kind of follow our recommendations. But it's a great book to identify what adrenal fatigue is, how to test it, and more importantly, what you can do to actually improve your adrenal health.
See, Doc, I thought I was working out lean, and I told you I was going to be working out and lose weight. But I can't out-train a bad diet, but maybe now you give me something else to think about. It may be the stress level I may be under.
Absolutely. People negate to realize just how much stress is negatively affecting their health. And with today's society, we're constantly on the go. Early morning alarm clocks, traffic, you name it. Our bodies just weren't designed to do that originally, and we're paying a big price for it.
Well, so with that being said, Dr. Hunt, what are we supposed to do?
Yes.
Because you mentioned most of us are really stressed, and you say, well, we can't lose weight if we're too stressed necessarily.
Right.
What do we do? Is it a matter of really taking steps to be aware of the amount of stress in our lives?
Yeah, you know, being aware is absolutely the first step in the process. Anytime we can schedule out our lives a little bit better, a lot of people just live by the moment and they react versus proact. And that's one thing we try to help people understand. And the second thing is sleep is very important. A lot of us try to do too much. You know, we run on both ends and we try to get away with as little sleep as possible, but sleep is restorative. And one of the things we allow our patients to do is sleep in, because when you can do that, you can actually heal. You may not be able to do it every day, but the days you can, you're going to want to be able to do that.
I'm going to be late to work because my doctor told me I could sleep in. I like the sound of that. I like that. Another way to learn how hormones play a role in fat loss is that you can attend a free dinner with Dr. Hunt. There are 2 coming up this month?
Yes, 2 more this month. I think we have one next Tuesday and then the following Thursday. But you can check that out online at our website, freedinnertalk.com, and get involved.
That's great. To register for the dinner, again, freedinnertalk.com, freedinnertalk.com. You can also call Hunt for Wellness. The number, it's there on your screen, 704-588-1792. 704-588-1792. Dr. Tunis Hunt, thank you very much.
Thanks for having me.